I wonder if this story will get much run. Injecting men with the female hormone progesterone could reduce the severity of their 19, study claims. Experts recruited 40 male patients who had been hospitalized with COVID. Half were treated with a 5-day course of progesterone injections twice daily. This group scored 1.5 points better on a 7-point clinical scale after 7 days. While the results were promising, the team said larger clinical trials will be needed. Female hormone, progesterone, given everything going on in our society, here in the US anyway, I know where your mind is going, so I did a little research. Just bear with me on this. What's a normal progesterone level? Progesterone levels are measured through a blood test. It's important to remember that progesterone levels fluctuate throughout the menstrual cycle, so levels can vary throughout the month. Progesterone levels are measured in nanograms per milliliter. The chart below lists the normal levels of progesterone for an adult female during different points of the menstrual cycle and pregnancy. So you see over here we have the stage, pre-ovulation, ovulation, post-ovulation, first, second, and third trimesters. And then over here on the right, they mention the levels. So nanograms per milliliter, if you recall. 0.89 pre-ovulation. During ovulation, 12. Post-ovulation, 1.8 to 24. And you see the numbers here. First, second, and third trimesters, those levels of progesterone increase. What's that have to do with men, you may ask? And a lot of you may know this already. Some of you may not know or have cared to even know. But it says here, progesterone is found in much lower levels in men and isn't typically tested unless adrenal gland dysfunction is suspected. Normal levels are less than 0.20 nanograms per milliliter. So men have progesterone in their body, albeit a small amount, about, we say, a fourth to a little bit less than a fifth that of a pre-ovulating female. It says here in males, progesterone is also produced in the adrenal glands of males. Its function is associated with sperm development. Injection with the female sex hormone progesterone could improve outcomes for men hospitalized with severe COVID-19 infections, a study has concluded. The finding by researchers from California follows multiple reports that men are at a higher risk of severe illness and death from coronavirus than women. Men are more affected than women by the CV. That's why I was questioning how much traction this would get in the mainstream media, how much run, how much airtime it would get. Interestingly enough, perhaps not surprisingly enough, in California, they thought to do this, but you know how it is. We can't jump to conclusions. We have to read a little bit. Perhaps there's some positive that can come from this. Progesterone has certain anti-inflammatory properties, and thus, the team said, may be able to dampen the often fatal immune responses called cytokine storms. The research was undertaken by pulmonologist Sara Ghandehari of the Cedars-Sinai Hospital in Los Angeles and her colleagues. As an ICU doctor, I was struck by the gender disparity among COVID-19 patients who were very sick, remained in the hospital, and needed ventilators, she said. Progesterone is produced in both men and women's bodies, although the latter produce considerably more of the hormone during their reproductive years. Experts have also noted that premenopausal women tend to experience less severe cases of COVID-19 than their postmenopausal counterparts. And that makes sense given what we read in the previous sentence, where it said that females produce more of it during their reproductive years. So as they age, right, postmenopausal, they would have less. So that's how they're trying to tie progesterone to some possible benefits, seeing the impact on females at different age groups. Premenopausal women tend to have higher progesterone levels, while such tends to decrease to lower levels post-menopause. In their clinical trial, which was undertaken from April to August last year, the researchers recruited 40 male patients who had been hospitalized with moderate to severe COVID-19 and randomly divided them into two groups. One group acted as a control sample for comparison and only received the standard medical care given at that time for the disease. The experimental group, meanwhile, received 100 milligram injections of progesterone twice daily for 5 days during the time they were hospitalized. All of the patients were assessed by the team daily for either 15 days or until they were discharged from the hospital. On the 7th day, each patient was ranked on a standard 7-point scale of clinical status, which ranged from 7, not hospitalized, no limitations on activities, through to 1, death. Certainly you want to be somewhere away from the 1. Give me a 2, 3, 4, anything but 1. The researchers found that compared with the control group, patients who received the progesterone treatment scored a median of 1.5 points higher on the scale. The experimental group also had fewer days of hospitalization overall and a lower need for supplemental oxygen and mechanical ventilation, although the team said the differences between the groups in these areas was not statistically significant. No serious adverse side effects were observed as a result of the progesterone injections. 2 patients did die during the 15-day study period. Obviously, they would have scored 1 on that 7-point scale, 1 from each of the 2 groups, but such were unrelated to the experimental treatments, the team said. While our findings are encouraging for the potential of using progesterone to treat men with COVID-19, our study had significant limitations, cautioned Dr. Ghandehari. Firstly, she explained the sample size was relatively small and was primarily made up of white, Hispanic, and obese individuals with a moderate burden of other conditions, which serve to increase the risk of worse outcomes. Furthermore, while the trial was randomized, at least there were some Hispanics in there, so I was thinking about all the stuff they have going on when they talk about race and everything. Furthermore, while the trial was randomized and featured a control group, it was also unblinded, meaning that the research team, physicians, and patients all knew who had received the experimental treatment. Further research is necessary in larger, more heterogeneous populations, including postmenopausal women, and at other treatment centers, Dr. Ghandehari said. This, she continued, will allow the team to establish the degree of clinical efficacy and to assess any other potential safety concerns of this treatment approach. The full findings of the study were published in the journal Chest. That's what the journal is called, Chest. I'm assuming that's a female-centered publication. It may not have any impact on this particular disease, obviously with the vaccination coming along now and moving along 1 million per day is what I've heard. But there may be something that can be gleaned from these studies, which Dr. Ghandehari mentioned, something that can be gleaned that can be used for future incidences, future pandemics, things similar. We learn, adapt, take these lessons, and perhaps going forward, if something happens like this again when we're waiting on a vaccine, then some of these things that they're learning now can be applied in the future to help save lives. What is progesterone? Not going to cover that. You can pause it right here if you want to go ahead and read over that. I'll zoom in on it for you so you can read through that. But that's actually the article. That's it. So, hey, I guess it's not as bad as what you might think it to be when you first read female sex hormone. They want to try it out on men, and it's happening in California. There's a whole lot of sketchy things going on there. Rubbish article. Men also have progesterone. Google it. Progesterone is known as a female hormone, but males need progesterone to produce testosterone. The adrenal glands and testes in males produce progesterone. Well, there you go. That's what we mentioned in the other article. On the downside, Boris, it's Boris Johnson, would want to be called Doris. Someone says here, I'd rather risk the virus. Perhaps, but I would be willing to bet if that person was on their sick bed, I'm not going to call it a deathbed, but if they were on that sick bed in the hospital, they would be trying to ask the doctor for something. The nurses, the staff, give me something. Is there anything you have? It's easy to talk when you're typing behind the comfort of a keyboard. Kris Kardashian accomplished with her husband, the secret dream of all women. Oh boy. Poor Bruce. These scientists have no respect at all. Instead of promoting this nonsense, they should be teaching folk how to build up their immunity. As they well know, vitamin C, D, and zinc have all been shown to be helpful. The government also should help these folks lose weight and lower blood sugars, since obesity and diabetes are the main underlying conditions that lead to complications with COVID. And this is what I mentioned last night in my video, and then about a week or two ago, where I thought it was 77%, looks like 78%-ish of those individuals who contract COVID are obese. That's the point that this individual is going to there. If you're fat and you're out of shape, just a blob of goo that you've just been laying on your couch for the past year trying to hide out from this thing, maybe it worked. Hopefully it worked. If you're one of these individuals, hopefully you're still alive right now, albeit if you're just like Pizza the Hut sitting on your couch. I really hope, and I mentioned this several times over many, many months, I really hope that you've taken this opportunity to try to do something to better yourself. You don't have to. We know how it is. You get celebrated for being less healthy these days than being more healthy in the media. I think that you know that if you're somebody in this condition, that you'd have to question why companies are actively promoting that you partake in an unhealthy lifestyle. Again, that's your call, but I would hope that people out there would want to live longer and do things to put themselves in a position to do so. I try to do so. You live your life the way you want, of course, but hopefully you can see these numbers and just say, hey, where do I want to go in my life? Which direction and which path do I want to go down? It's already in the water supply anyway. With a large majority of women on the pill, where do you think those hormones go after using the toilet in a circular water system? How degrading. Now they're trying to turn men female. What a joke. They've been doing that for quite some time. They're my UK comrade. And also men willingly turning themselves as females by choice. So what can you say? All right, so as I said, not as bad as you'd think. Perhaps there's something there. I don't want to have anything to do with it. If I'm ever laid up in the bed with this stuff, chances are I did something wrong and I wasn't staying active and staying healthy. Fingers crossed that doesn't happen. As I mentioned before, I'm avoiding the vaccine, and if I do end up in that hospital bed, as I said, I would probably be avoiding the progesterone. I don't know. I don't want to have anything to do with it. Take care, everybody. Thanks for watching, and be well.